Yeah, I'm Rhian Parker. I'm an associate professor at the ANU, and my book is called Women, Doctors and Cosmetic Surgery, Negotiating the Normal Body. Well, cosmetic surgery is any surgery that we would regard as plastic surgery, but isn't there to repair any damage or isn't actually necessary. It's for cosmetic purposes. So, for instance, facelifts, rhinoplasty, breast implants, those kind of things are cosmetic procedures. We do not have any data on how many of these procedures are carried out every year. Neither do we have any data on which practitioners are carrying out these procedures, because in fact you do not have to be a qualified surgeon to carry out these procedures. Anyone who has a medical degree can carry out a range of procedures, not just Botox injections, but actually quite invasive procedures as well. Women choose to undergo cosmetic procedures for a range of reasons, and the findings from my study were consistent with the literature. There are three reasons. One is that it's something that has bothered them for a long time. Usually that relates to a large nose or small breasts. The second reason is it's something that's happened to them, usually as a result of having children, so they haven't got a flat tummy anymore, or they feel their breasts have disappeared after breastfeeding. The third reason, obviously, is aging. They look in the mirror and they look older than they feel, and they look tireder than they feel, and they just want to freshen up and look better versions of themselves. The response I got from doctors was that it was interesting. Only one doctor said that he was actually doing it for the money. He said that he was tired of getting up in the middle of the night as a plastic surgeon for road traffic accidents, and he said he could make more money doing this. All of the other doctors gave a range of other reasons, including they like precision, they like the artistry of the work, and they felt they were perfectionists and this suited their personality. What we have is women going into cosmetic surgery with very little knowledge of what it entails, and they don't know what questions to ask. So they go in often in secret because they don't share their wish for cosmetic surgery with others. They access a cosmetic surgeon or a plastic surgeon, and they go in for a procedure that they don't understand the risks of, and they're doing it in secret without support. What they get often is doctors who really don't understand why women are there. Women want to look better versions of themselves. They don't want to look like anybody else. However, and interestingly, from my work, I found that all but one of the women I interviewed who had breast implants had larger implants than they'd asked for. All of them bar one had asked for C-cup implants, and they got at least D-cup implants. Now that's interesting because we know from the psychological literature that men's preferred breast size is larger than women's preferred breast size. So I think what's happening, unconsciously maybe, is that male doctors are giving women larger implants because basically that's their preference, and women don't want those implants because what they want is to look normal. From having a flat chest, they now have a very large chest, and they stand out again for the wrong reasons. So women would say to me, people don't look at my eyes anymore, they look at my chest. Well, I think there are a few policy implications. The first thing we need to do is actually count how many of these procedures are being conducted in Australia every year and by whom. The second thing we need to do is have some quality control mechanisms around the whole industry. What's currently happening is that because a range of practitioners can carry out these procedures, what's currently happening is that there is a turf war. There's a huge argument between them about who should be doing this work. I think we need to move away from that and actually look at how we make sure that we have quality in the industry, because it's not going to go away. The second thing we need to do is we need to provide much better education and information for those people who choose to undergo cosmetic surgery, so that they know what questions to ask when they go into that clinic. The third thing we need to do is gather information from every single health complaints committee around the country to know what's going on, because anecdotally we hear that part of the reason that insurance premiums are going up for medical practitioners is the large number of complaints about cosmetic surgery procedures. Now, we need to understand that better, because obviously it's costing the whole medical industry something if that's the case.